Hello, my name is Chaundra McGill, host of the YouTube channel My So-Called Disabled Life, a life coach for the disabled and a motivational speaker. My journey with multiple myeloma didn't start when I was diagnosed. It actually started before then. In 2010, I had a brain aneurysm and an AVM, which is an arteriovenous malformation, a bunched up blood vessels in your brain. I had to have urgent brain surgery. They were successful in rectifying the brain aneurysm. However, while they were pulling out the tools, an adjacent blood vessel ruptured and I had a stroke on the operating table. I was temporarily wheelchair bound. I had extreme facial drooping. I lost hearing in my ears. I had something called wild eyes, where my eyes spin independently like pinwheels, and then they settled in different places, so now I have double vision. I had a lack of coordination on the right side of my body. I even had to learn how to swallow again. 6 months later, I had a facial reconstructive surgery to help with the facial drooping. This surgery was successful. However, when a person has a stroke, they have a very small chance of acquiring a chronic pain condition if their body endures a trauma, say like an accident or a surgery, which I did. This chronic pain condition is called central pain syndrome, and I battle that as well. All of your muscles ache as if you've had the flu, but it's the worst flu that you can possibly imagine. All of your joints hurt as if they are arthritic. Your knuckles, your ankles, your elbows, everything. And your skin, it feels like someone pours gasoline on you and lights you on fire. These pre-existing medical issues led me to go to my doctor's appointments quite frequently. My doctor routinely took my blood, but one instance she was concerned about a protein she saw in my blood and advised me to go see a hematologist. I asked her how serious she thought this issue was, and she said she thought it was very serious. And I thought it was a joke. I'm like, how serious can it be? I mean, I just went through brain surgery just a few years ago. But I went to the hematologist. I got a bone marrow biopsy, and it was determined that I had multiple myeloma. It was in my shoulder, and it was in the smoldering phase. They decided not to treat at the time, but I was given frequent skeletal surveys and tests to monitor the multiple myeloma. About a year and a half later, my kidneys began to shut down. Doctors had a suspicion that this was due to my multiple myeloma. They ran a battery of tests while I was in the hospital for 2 weeks. I had another bone marrow biopsy, but there was no indication my kidney decline was related to the cancer. Shortly thereafter, I had a nagging back pain for a few months. I figured I put on a little bit of weight. My back was hurting. Then I was in a low-speed accident. Someone rear-ended me at a really low speed. Then my back started hurting really bad. The pain was very disproportionate to the impact of the accident. Due to the excruciating pain, I went to the hospital. After conducting an MRI, doctors discovered that my L2 vertebrae was crushed like a pancake due to a tumor in my spine. So my multiple myeloma metastasized to my back. I also found out I was stage 3. My initial thoughts were, not again. Just going through brain surgery, I knew that fighting through an illness takes such internal fortitude. And simply, I didn't want to go through it again. I knew this would be a battle for my life. Doctors started radiation immediately. However, radiation didn't work. My tumor was radiation resistant, which freaked the doctors out. So I had a 2-day back surgery. One day, they went into my back and removed the tumor, and the next day, they placed a rod in my spine to stabilize my back. I wore one of those like turtle shell back braces for 4 months because of my broken back. At this point, they started chemotherapy. I would go to the infusion clinic at the hospital every Monday and Thursday. I had a wonderful doctor. I could never continue to sing his praises. He told me very shortly after my back surgery and starting chemotherapy that if I were you, I would go see a doctor at Harvard who was one of the leading specialists in the world in multiple myeloma. Within 3 weeks, my mother got me an appointment with this doctor at Harvard, and we were flying up to Boston. He took a look at my file, and the first thing he said was, "We have plenty of treatment options here." That was a big relief. He immediately put me on an intense regimen of shots, IV, and oral chemotherapy, other medications, and supplements. I was taking upward of 45 pills a day. I was getting full off of pills. My doctor in Louisville, Kentucky, graciously followed this plan, and I started getting better. But just as things were seeming to get better, life has a way of throwing you a curveball. 7 months after my back surgery, my mother was diagnosed with multiple myeloma in her back. It was located in the muscles in her back and was rubbing against her spine. She had to have 2 rods placed in her back. When she woke up from surgery, she could only wiggle her toes. Doctors told her that she would never be able to walk again. So now I am at stage 2 multiple myeloma. My mother was my caretaker, but then now I had to become her caretaker. So I have cancer, and now I have to take care of a person who was completely wheelchair bound. To make matters more complicated, we lived on a 2nd floor, and there were no elevators, just stairs. So we had to move to a handicap accessible apartment on the 1st floor. We didn't have any family, so I basically had to pack up the whole apartment myself with a broken back. However, we were very blessed because we have some very dear friends who stepped in as family at this extraordinarily excruciating time. This by far was the worst time in my life. It was crazy because my mother and I were going through chemotherapy together. We were going on the same days. We had the same doctor. We essentially went through the same journey together. She had a bone marrow transplant, which was successful, and she has been in remission for approximately 2.5 years. Now, I am so fortunate to report that my mother is no longer in a wheelchair. She graduated to a walker, then to a cane, then to no assistance whatsoever, even though doctors said she would never walk again. But she had a tragic fall that altered her life. While walking up uneven, unbanistered concrete stairs on our front porch, she lost her balance on the last step and dove head first into the wall of the house. She had 2 contusions on her head and a severe concussion. Blood was pouring down her face. Unfortunately, due to this setback, she is now walking with the assistance of a walker. Myself, I have been in remission for 3.5 years, after about 15 months of chemotherapy. I could not have had a transplant because of my previous history with stroke. Doctors told me that if I had a transplant, I was at a risk of having another stroke, and it would be a chance that I would not come back from that. So I go every week to chemotherapy, essentially maintenance chemotherapy. My doctors report that my blood work is excellent, that I should just stay the course, meaning remaining on maintenance chemotherapy. I now don't know how long I will remain on it. However, as long as it keeps the multiple myeloma at bay, I am completely compliant. Thank you so much for listening to my multiple myeloma journey. To learn more about my other life experiences, the experiences of other disabled people, and issues that the disabled face daily, please watch my So-Called Disabled Life YouTube channel. Be sure to subscribe and hit the notification bell to be the first to know about our new shows.